I'm Dr. Bill Burman. I'm the Director of Public Health at Denver Health. I think over the past week, we've had just additional confirmation that we had a post-winter holiday bump. That bump was not associated with an increase in hospitalizations, fortunately, but that it's receding. So our case rates have been steadily declining over the past week or so. Percent positivity of PCR tests has also declined, both in Denver and the state as a whole. And so I think that's all good news. The infection or transmission is still active, but it is decreasing in our community. Yeah, I certainly congratulate DPS on the first step in getting elementary schools open. I think that's a tremendous accomplishment for our community. Again, these are the kids who benefit the most from in-person learning and have the lowest risks of acquiring, transmitting, and suffering adverse consequences from COVID. So I think it's great that we could get elementary schools reopened for that key group. And then the plan is to continue to expand some degree of in-person learning for older kids. And I think, again, that's great for our community, great for our kids, most importantly. The most important thing all of us can do is to help keep community transmission under control. Because as we've talked about before, schools are not the driver of community transmission, but schools are affected by community transmission rates with increasing numbers of students and staff who either have symptoms or have proven COVID and have to be managed. We still think that in-person learning is safe under those circumstances, and the reason we say that is that in-school transmission remains very low. But the lower the community transmission rate, the easier it is for DPS to remain open. It's the usual things we've talked about for 10 months, starting with masking, probably the single most important thing that all of us can do to prevent transmission. A simple thing that by itself probably decreases transmission by 70 or 80%. That's amazing. Distancing, avoiding crowds, hand washing, all of those things, the package of those works, and we need to continue it. This variant, the UK variant, is transmitted more easily than previous variants of COVID. And that's certainly a concern, without question. And anything that would increase COVID transmission is a concern in our community. However, it remains very uncommon in Colorado to date. So there have been 5 cases identified thus far. There's a very active effort to identify these strains and understand what's happening with them. I don't think any of this needs to change the current plans for school reopening, nor does it change, importantly, the things that we need to do, the things that we just talked about. And then finally, the evidence to date suggests that the vaccine will work well in preventing this strain as well. So one of the advantages we have that the United Kingdom didn't have during the upswing in this strain was we have vaccine. And so the hope is that with vaccine, we can forestall the impact, ameliorate the impact of this strain on our community.